and I declared a favored nations, most favored nations, where the United States from now on is going to pay the exact same price as the lowest price anywhere in the world. In other words, if you take... Right? In other words, if you take the country that's paying, and let's say in a certain part of, there may be some country out there that pays a little bit less for very good reasons because of the fact, a thing called poverty or whatever. But we take the lowest country, say European Union countries as a whole, that would be fine. Or take individual countries within the European Union, or take various countries that nobody's even heard about. We pay the lowest. And what that's going to mean, and I'd like to put somebody to police it because it should start immediately. It shouldn't start in 2 years, 3 years, 5 years. They'll say, yes, it kicks in. They always say kicks in, Marty. It kicks in, sir, in 4 years, and then 4 years they get it changed. It should mean, so remember I told you I was happy with 1/4%. It could mean anywhere from 70% to 89% reduction in drugs and pharmaceuticals. That's a little different, right? And I've actually had some congressmen call me and they say, sir, can we talk about this? I said, no. They wanted to talk because, there's tremendous power against them. And I understand that. And every one of them was covered. Senators were. I see Roger smiling, and Roger probably was too. But you know what? He wants to do the right thing, right? He wants to do the right thing. And we're doing the right thing. We're taking advantage of, and forget the drug companies, we're taken advantage of by other countries that insisted with the drug companies that they were going to pay X dollars, and we're not paying any more, and you're not doing business here. And they were nasty about it. These people are almost sort of afraid of them. And we are going to now get a reduction in drug costs of up to 89% in some cases, but 50% would be a bad number. So think of that, 50% versus 1/4%. Think of that, 85, 89, 91, 72%. It's going to be massive numbers. It's going to be incredible for Medicaid, incredible for all forms of health care. Medicare is going to have a huge impact, so big that nobody can calculate it. I mean, this thing could drop by 25, 30%. The drugs are a very big part of it, right? So very big part. So it'll affect everything. It'll affect your whole life. The amount of money you're going to be saving is going to be incalculable.